Design challenges are things we've been doing for a few years now. In Southwark and Lambeth, we've got the Knee High Challenge.
The main aim of the Knee High Design Challenge is to really improve the health and well-being of children under 5 living in Southwark and Lambeth and hopefully beyond. We welcomed 25 teams into the first stage and just gave them quite a small amount of money and not a huge amount of time to rapidly prototype their ideas.
We've kept the whole process really open so that it welcomes not just your sort of typical candidates of designers and entrepreneurs, but also that it brings families into the process.
And we're listening to pitches from people who 12 months ago had an idea on a piece of paper and now they're making it happen, and it is across the board utterly inspiring.
I think it's a new way of thinking actually. It's looking at concerns, issues through a different lens.
This is a much more thoughtful and creative way of supporting change. So this challenge approach that Design Council has supported is fantastic.
One of the challenges is balancing that sense of giving people genuine permission to innovate and experiment and take risks, and then pushing people pretty hard to start telling us what they're really doing that's making a difference.
What really excites me about this project is the fact that it's bringing together the worlds of thinking, creative approaches to tackling this particular problem with really strong scientific rigour.
It's been really interesting to see what people have come up with and then being refined more and more, and so that's been it's been a privilege actually to watch that process. Having that time to be able to test things out with the public, look at how well it works and how it doesn't, adjust things as they go is really important.
It's been really tricky to choose which ones go through to the next round.
They're all coming at it from quite different angles and they're also hugely passionate. So when you've been along the journey with them, it is quite hard to choose between them.
We've had a lot of feedback from experts in the field, from people who are really good at design thinking. It's been an amazing way to develop a new service.
It was absolutely amazing to be able to have the resources and the time to think about what we do in terms of design, come away from a family, think about what hasn't worked, rejig it, and always question what we're doing to make it better. And I think that's what the Knee High Challenge has allowed us to do.
We've managed to actually put into practice the whole design methodology, starting with a challenge, working with parents, our user group, to understand that challenge and build a solution to it.
You listen to the people that you work with, your customer, and you feed that back into the process and you iterate your design and your service as you go.
It's really been amazing for us as two single moms whose kids want to climb on them all the time, that we've been able to build this together as moms, and we've been able to see the impact that that has on other moms, and that we've been able to make them feel better about their circumstances.
This started as something that was about nurturing a very simple idea. We then grew in confidence through this process as we saw just what that idea could turn into, the solution it could turn into. And at the end of it, we feel really empowered to make change in the community in which we live in and to be partners in a business. So it's a massive journey for us.
This programme has provided so much learning for the public sector and public health more widely, particularly around that sense of, where do really good ideas come from? And they don't always come from conversations in meeting rooms.
We don't in the public sector have full monopoly of all the solutions or even all the methods and ways of solving problems.
The reason that this has worked, this process, is because it's people that have come from the community and come from the service users themselves.
This is quite hands-on, communities get involved, there's opportunities to showcase to local councils or health sector representatives and really bring everyone on board.
It's been absolutely astounding, absolutely gone kind of over and above what I thought that we would learn from this project.
All funding streams should be something far closer to what the Design Council has done with us, something that's like a professional relationship about learning together.
I feel immensely proud of everybody that's worked on this project and immensely grateful for their time and energy, because looking at it today, it's just blown me away.
If you've got good people around you, the sky's the limit.
We're all striving for the same thing, and it feels it feels really, really great to be part of something bigger.
I feel quite proud that it as an entity has worked.
The Knee High Challenge has been really a brilliant way to give us the skills and confidence we need to take ourselves from just being two parents with a problem to directors of a company which has built a solution to that problem.